My name is Tom Barman. Along with Bridget Flanagan, I'm one of the principals of Tenfold Senior Living. When we started Tenfold, we did so with the intention of being different by design. We wanted to create an experience where residents could lead truly independent lives with all the necessary supports to enable autonomy. And from your feedback, we've been tremendously successful. However, COVID-19 has come along, and it has been incredibly challenging for all of us since. Since mid-March, my family has rarely left our home. Our kids are distance learning from home and likely will be for the foreseeable future. Nothing is normal right now. So the difficult question that Bridget, Cheryl, Eric, and I and the rest of the team ask on a daily basis is, how do we find the balance between keeping this community safe and also delivering on the tenfold promise of lifestyle and autonomy? How do we get back to those amazing events and adventures that Darlene and her team used to deliver? How do we get back to eating and drinking together on a regular basis in the dining rooms? And how do we get back to gathering and sharing our stories and our lives together? The answer: slowly, incrementally, thoughtfully. Things are going to continue to look different for a long time, but we know that they're going to continue to be amazing and that they're going to continue to get better. Hopefully by now, most of you have been able to experience the limited dining service in Cypress Room with Chef Tony's amazing specials. We're working hard at adding lunch service so that more people can enjoy dining on a daily basis in the restaurants. We're working hard at coming up with new and engaging events and adventures that can be done safely. And most importantly, most exciting, we're adding a new visitor tent outside the central courtyard where families can come for short visits, but do so safely with appropriate distancing in a climate-controlled environment that is outdoors. And while doing so, we can preserve the central courtyard for the use and enjoyment of our residents. These are a few of the things that we're doing to deliver on the tenfold lifestyle, and we'll continue to think creatively. One of our values at Tenfold is honest communication. So we want to invite you today into a dialogue about the appropriate balance between safety and lifestyle and autonomy. To start that conversation, we've invited Josh Allen, a registered nurse and COVID-19 expert, to share some of his experiences working with other senior housing communities throughout the Western states. We value your input, and we ask you after this presentation to talk with us, any of the team members or myself. My contact information is below. Share your thoughts and ideas. How do we achieve the right balance? Together, we can stay safe, and we can deliver on the tenfold promise. But it's going to take all of us, all the team members, all the residents, all the family members working together. Together we are strong, and together we can get through this. So thanks for your patience, thanks for your feedback. I look forward to continuing this conversation with you, and I hope you enjoy Josh Allen's presentation.
Hi, my name is Josh Allen. I'm a registered nurse who specializes in assisted living and senior living. And I'm here to talk with you today about COVID-19 and what we're doing to work together to keep our community safe. Compassion is one of the core values at Tenfold Senior Living, and it's something we work to incorporate in everything we do in our communities every day, including how we're responding to COVID-19. To say that this has been a challenging time for everyone is an understatement. Working through guidelines, protocols, best practices to ensure safety, but at the same time maximize quality of life is something we're working to do every day. And we want to have an open conversation with you today about where we are and where we're headed. During today's discussion, we'll talk a little bit about COVID-19 and how it spreads, some of the things we can do in our community to reduce the risk of spreading COVID-19, and then we'll talk specifically about some of the unique challenges facing senior living. We've learned a lot about COVID-19 since it first appeared in the world and specifically here in the US, and we're still learning more every day. But we do know that COVID-19 primarily spreads through the transmission of droplets from person to person. I'm sure many of you have seen pictures like this one before. You're probably familiar with the idea that every time we let air out of our lungs, there's some moisture, some droplets that come with it. Whether we're talking, or especially if we're coughing or sneezing, those droplets get released from our lungs. If a person is infected with the virus that causes COVID-19, those droplets coming out of their lungs can bring the virus with it. The virus could then be transmitted to people who are within close contact. The estimate, as I'm sure you've heard, is about 6 feet. Now, it's not always exactly 6 feet, but we know that the droplets that could be carrying the virus, that's about as far as they can travel. And then they begin falling to the ground just through normal gravity. If someone who is within close contact were to have those droplets enter their lungs or even their mouth, nose, or get into their eyes, they could then become infected with the virus. So it's this person-to-person transmission through droplets that is the primary way that we know the virus is spread. And it's a big foundation for a lot of what we do to reduce the transmission, as we'll talk about in a few moments. Now, one thing that's important to understand is not everyone who is infected with the virus will feel sick. Some people remain what we call asymptomatic, meaning they don't have any symptoms of disease, but they in fact are carrying and potentially spreading the virus. That certainly appears to be one of the real challenges with COVID as compared to some other respiratory illnesses, is it appears to be transmitted easily even if a person does not have symptoms. Now, that person-to-person droplet transmission is the primary route, but there are some other ways that the virus could be spread. One possibility is that it could be spread by touching a surface or an object that has the virus on it. So if you imagine again those droplets coming out of someone's lungs carrying the virus, if those droplets land on a surface and then you were to touch that surface, you now have those droplets with virus on your hands. If you were to then touch your eyes, nose, or mouth, the virus could be transmitted. And the reason for that is your eyes, nose, and mouth have what we call mucous membranes. Now, mucous membranes play an important role in the body, but unfortunately, the virus can be transmitted through those mucous membranes. Now, this contact with contaminated surfaces is not believed to be the primary route of transmission, but it is possible. So with that in mind, the things that we're doing to stop the spread are very much focused on those routes of transmission, as you could imagine. And I'm sure these are things that you've heard many of us talk about maybe more times than you'd care to hear it, right? It's something we're talking about all the time these days. But it's important to understand that by working together to implement these practices, we can help to stop the spread of the virus in our community. One of the challenges with many of these interventions is they're pretty simple. They're pretty straightforward. They're not a magic pill or a drug or a cure. They're really simple things we do through our own behaviors and actions every day. But by following these simple practices, again, we can help to stop the spread of the virus. Of course, the first thing is regular hand hygiene. We want to wash our hands frequently. Now, there are some obvious times that you should do this. For example, before eating, after using the restroom. One of the good rules of thumb we talk about is making sure to think about washing your hands at least 5 times per day. Now, some days you might need a little bit more, obviously, but if you think about 5 times a day, that's at least once before every meal, and then a couple other times throughout the day. That kind of regular hand hygiene is going to help to keep any of those viruses or other germs off of your hands and prevent them from getting into that eyes, nose, or mouth, as we were talking about. Of course, we know wearing a mask is important. You see all of the staff around the community wearing masks. We also ask our residents to wear masks if they're going to be outside of their apartment or if they're going to be having contact with other people. The primary idea behind everyone wearing masks is what we refer to as source control, meaning if I was infected with the virus, by wearing a mask, I'm going to help to protect you from those droplets. The mask is literally a physical barrier to keep those droplets from spreading to other people. So generally speaking, for our residents and other folks who might be visiting the community under allowed visitor protocols, a cloth face mask would be appropriate. So we would ask you to wear that when you're out of your apartment, when you're around other people, or any time, of course, that you leave the community to go out to an essential appointment. Social distancing, it's the phrase of 2020, right? We talk about it all the time. Again, keeping that 6 feet of separation, it helps to prevent those droplets from being in contact with someone else. So we want to think about that 6 feet of separation, even as we start to phase in things like dining and activity programming, even possibly visitors and so forth. Anytime we're around other people, we just want to think about keeping that 6 feet of separation. Obviously, if you're not feeling good, we want you to stay home. We want you to stay in your apartment. And we'll be working with you as well as your physician to make sure you receive the care that you need. Those practices, as simple as they sound, if we all take responsibility, we all take that personal responsibility to implement them, they are at the end of the day what's going to keep all of us protected from the virus that causes COVID-19. Now, obviously, in senior living and senior housing, we have some unique challenges that we really need to think about and address. And again, we want you to understand our perspective and how we're approaching these. A lot of what we're trying to do is balance these two important things. We want to balance safety, which in this context means trying to keep the virus out, but we want to balance that with independence and quality of life. And that's been a tricky balancing act these last few months. Working through the recommendations that we receive from the CDC, from the state of California, from the Department of Social Services, working through those recommendations to help keep us safe, but also balance the need for engagement and interaction with others and being able to communicate with family and friends. It is important to understand that there are some groups that have a particularly high risk when it comes to COVID-19. And the two big risk groups would be both older adults as well as folks who have underlying medical conditions. We know that the statistics tell us that with increasing age, the likelihood of not only becoming infected with the virus, but more significantly, the likelihood of getting sick goes up. Remember, we said that there's a significant percentage of people who are infected with the virus who in fact have no symptoms. Some estimates are as high as 50%. As we get older, or if we have underlying health problems, the likelihood of us getting sick, developing COVID-19, possibly requiring hospitalization, or even the most serious potential outcome of death increases. You can see on this chart from the CDC, for example, that someone who is over 75 years of age is 8 times more likely to be hospitalized due to COVID-19, and they are 220 times greater risk of death. The reason we share this is not to scare people, but to really underscore the rationale for all of the protocols we've been implementing throughout the pandemic in an effort to keep people safe. Whether it's the masks or the social distancing or the restrictions on visitors, and the different things that we've been implementing, it's been focused on the reality that many of the folks who live in our community are in this higher risk population, not just because of age, but also because of the challenge of underlying medical conditions, such as diabetes, emphysema, or congestive heart failure. But we are cognizant that there's that balance we were talking about, the balance with safety, but also balancing that with independence. And this is where we continue to work with the experts at the CDC and the state of California, and also with you, our residents, to find protocols that let us stay focused on safety, but also balance your need and your right for independence, engagement, and connection with others. Probably the biggest question we all ask ourselves is, how long will this go on? And when it comes to COVID in these last few months, we've been on a little bit of a roller coaster ride, right? We had that initial surge in March and April, and then we started to see a decline in cases. We were flattening the curve. And then unfortunately, in these last few weeks or months, we've seen a rebound. The reality is it's lasting longer than anyone wants. The reality is COVID's not just going to simply disappear one day. It's going to be an ongoing public health effort for really the foreseeable future. I think at a minimum, we all recognize we're talking months, at least through the remainder of this year. And really, no one has a crystal ball and can tell us exactly when this will all end. Of course, right now, we wonder, will a vaccine be the answer? And there's good reason to believe a vaccine will be an important part of the solution. But even a vaccine may not be a light switch. It's not going to just cause COVID to disappear one day. It will require time as people take the vaccine and begin to develop that immunity. As you know, we continue to work through reopening different aspects of our community, whether that's our dining or activity programs, welcoming visitors in some limited capacity. And we work through the various state agencies and federal guidance that allows us to do that. I think the most important thing for us to remember are these three key points. That number one, our response to COVID-19, it's a shared responsibility. None of us can do this on our own. We really depend on everyone to work together. From the staff who work in our communities, to the residents who live in our communities, to all of the individuals who would be in our community on a day-to-day basis, from home health providers to family members. We are very focused on that core fundamental belief in the importance of compassion for each other, being understanding that we're all going through challenging and frustrating times during our COVID response. We will continue to work to communicate, to be transparent, to talk to you about what we're doing and what we're thinking and our reasoning behind our various protocols. We're so thankful for the partnership with you. We're thankful for the opportunity to work together as a community to continue our response to COVID-19. As always, don't be shy to reach out to any member of the Tenfold Senior Living team to talk about any of these questions or challenges that we're all facing. Thank you so much.